So what are the clinical features that you will find? First of all, you need to know potential MCQ. What is the hallmark of IgA nephropathy clinically? The clinical hallmark of IgA nephropathy is a recurrent gross hematuria. So in one word, in one sentence, if you have to tell the clinical hallmark, that is recurrent gross hematuria. Recurrent gross hematuria, it is episodic and it is often precipitated by, as we have already discussed, upper respiratory like illness. So URI like illness, it will precipitate it and it will happen within 1 to 2 days of the onset of URI. And each episode will last about 2 to 5 days. Nelson gives a value of 5 days. Most other textbooks give a range. They give 2 to 5 days. So within 5 days, the episode will resolve, and afterwards it will be gross hematuria again sometimes happening. Other than gross hematuria, other clinical manifestations which can happen. Some of these children can have microscopic hematuria. Certain children can have proteinuria. The proteinuria is not significant, and proteinuria is always less than 1000 milligrams in 24 hours. Certain children can have a mixed nephrotic with nephritic kind of picture as well. Mixed nephrotic-nephritic syndrome like picture can also develop in certain children. Hypertension can also be a manifestation, but it is usually mild to moderate. Severe hypertension or hypertensive encephalopathy is not very frequently found in these individuals. Overall, we find that the disease is more common in Southeast Asian countries and East Asian countries, especially Japan, Korea, China, and Taiwan. It is also seen in Indians, but in India, the usual age of occurrence is more in the adolescent and adulthood compared to Western population. It is much less common. Then you will say that there are Indian countries. Then you would say that there are African and Western countries where it is found. So India lies somewhere in between, and in Indian population, it tends to occur in the older age group compared to younger age group.